So the question often comes up in a nursing home abuse case, how long does it take to resolve that claim? And especially in situations where the negligence and the abuse has been going on and on for a long time. So because we have very experienced lawyers on our nursing home abuse legal team, if you call in, they'd be happy to give you an answer tailored to the specific situation. But in general, if you talk to one of our attorneys, and it's happened recently, here's what they say. They say that it's very common for the nursing home to what? To try to cover up what happened, to downplay it, to paper it over, to, get a medical doctor to sign off on a death certificate without even examining the body. This happens, okay? And so those are all common things. So it often takes a while for us to sort out the truth. But I'll give you two situations which actually happened. So if your loved one was, and by the way, if they pass away and you suspect abuse, it's very, very important to get an autopsy done. Because once especially nowadays, the body's cremated, most of the evidence can literally be destroyed. So make sure an autopsy is done. But beyond that, and if you have any questions, call our office. We can help you through and refer you to some good pathologists. But as far as how long the process can take, we had a situation where anytime your loved one has a pressure sore, or it's also called an ulcer, it's from being in a bed and not being regularly moved and turned. And if you yourself lay in a bed and never move, except maybe just once in a blue moon, you'll develop pressure sores and ulcers yourself. And then if you're older and your skin is more fragile, or especially if you have diabetes, oh my gosh, it's guaranteed. So anytime if you go visit your loved one, don't just sit there. And I know that there's more restrictions right now and things like that. But even on a Zoom situation, ask the nurse and just say, hey, I would like you to turn my loved one over and look at their buttocks particularly. That's the area that often develops the pressure sore. And if they go, no, we don't do that, sorry, that instantly should make you suspicious. And so, but you can actually hire a private nurse to go in and examine your loved one. And if they're like saying, no, you just talk a little bit on the thing and watch your aunt or whatever, that's it. Very much you need to consider hiring somebody to go in and check on their health. And what happened in this particular situation was that the pressure sores got so bad, they got infected, and they went right into the bone, and their loved one was killed. And the head nurse said to the family, well, as bad as that is, one thing good is going to come out of your loved one's death. And they were like, what? And they said, we'll make sure that this never happens again. And the family was like, well, and we lost our loved one, and that's whatever. But that's what the nursing home told the family. And then, this probably won't shock you, but a few months later, we got a call from another family that what? The exact same thing had happened, and they had lost their loved one the same exact way because of neglect. All it takes is turning them over regularly, and pressure sores generally won't develop. But hey, if you just leave somebody in bed, including you or me, and never move them, that's what happens. And so the second time when it happened, we said, okay, that's it. And a lawsuit was brought, and the nursing home, of course, tried to say, oh no, we didn't do anything. I said, no. And I'll just use the common terminology. You got busted once, and you promised it would never happen again. And it was less than 6 months, you did it again. No, you're guilty as charged. And so they eventually ended up paying a lot of money. And yes, it was confidential, but it was basically because of that. I mean, and those are the people we knew about, you know. What about the families that didn't call us? So remember, if you have a situation involving suspected abuse, even suspected abuse, give us a call. We can help you out. We can help you out with investigators. And then you can confirm either, yeah, my loved one is getting good care, or much more commonly, oh my gosh. We've had families find out that their loved one was getting abused and neglected and gotten them out while they still could recover. And other families didn't find out until it was too late. So there's varying time to settle the claim, but the most important thing is gather the information, have us help you. We can prove the neglect, and then we'll help you get them out of that situation. Because those poor nursing home facilities, they want to hang on to those patients. Because why? They see them as dollars and cents. They're your loved one. Give us a call. The call is free. The information's free. And it could make a difference between life and death for your loved one.